Welcome, everybody. If you're here, please say hi on the stream. And apologies for the delay. So, welcome to MedX, to our webinar for the case for economic justice to address the COVID-19 pandemic. I just want to welcome everybody who's here, existing members. I'm going to be talking for about 30 minutes. I'd just like to say, if you have any questions, please put them in the comments. MedX staff are in the chat, and please put your names in the comments and say hi. And I can give you a shout out here. I just wanted to take this time, first of all, to address the extraordinary times that we're all facing. It is a difficult situation. I personally have had a lot of ups and downs, but I'm finding solace in the solidarity and the trust and the calmness shown by people working on the front line and by the community in dealing with this extraordinary situation. A little bit about myself first before we begin. So my name is Siddharth. I grew up in New Zealand. I'm originally from India. And in New Zealand, I worked in New Zealand's public health system, working as a socio-epidemiologist, working on health improvement issues. I was also a union delegate representing the public health workforce, and that's where I first started understanding the very political nature of what public health means. Public health evidence shows so many stark realities of the world, and for me, acting on them was really important, and understanding that they required changes at the political and economic level was vital to why I do this work and why I fight for some change. So for those of you who are new, I'm just going to tell you about MedAct a little bit. Our mission at MedAct here is to support health workers to work together towards a world in which everyone can truly exercise and achieve their right to health. I'm just going to talk about a little bit about how our movement fits in with everybody else. MedAct is a vehicle that mobilizes health workers, and we're part of a global health movement of progressive health workers. Equally, our members and supporters, that's all you, are in the position to lend a voice to a number of movements such as the housing movement, climate movement, economic justice movement, migrants' rights movement. Often, and I think there's a very important reason to lend our voice to these movements. The health voice is often extremely well trusted. Nurses, followed by doctors, are the most trusted professionals in the UK. And this is why MedAct contributes its voice to various social campaigns that might require a health voice to push them forward. Just before I begin, I know one of the most important things that we are all learning to deal with and learning to practice right now is social distancing. And I would like to just begin our conversation by just establishing the fact that social distancing, there's a difference between social distancing and physical distancing. What we need to show is physical distance from people, but we can still have that social solidarity. We need each other more than ever, and solidarity right now, sadly, looks like physical distancing. And I'd also like to acknowledge the other concerns that that might be having, especially in regards with the number of tests being done for the coronavirus infection, the lack of personal protective equipment, and clarity from the government. We recommend that you follow the BMA who've been fighting on this issue, and also look out for Keep Our NHS public action. And we are also working in this space, so we will keep you updated with this information. Our movement builder is in the chat, Rachel, and you can get in touch with her if you are interested in pushing these issues forward. So, a little bit about what has happened. We've had a pandemic of a novel coronavirus, and worldwide cases are doubling every 16 days. Known cases in the UK are doubling every 3 days. The problem is that the health system and health staff are not at a capacity to cope with the number of ill people that will be coming. Therefore, measures are being taken to drastically reduce community spread. These quarantine measures, combined with the death toll that we could face from the coronavirus pandemic, are leading to a social disaster on a scale that is unprecedented. The measures that we are being asked to adhere to, self-isolation, social distancing, those are going to have a disproportionate impact on people in precarious work, living on low incomes with little savings or with insecure immigration status. The effects of this pandemic and the economic crisis that it has catalyzed will be with us for a very long time, unless we act now to ensure that people's livelihoods and well-being is secured, that we eradicate poverty and hardship, that we support those on the lowest incomes and in the most precarious positions. The government response so far has been accommodative. It's been good to see that they have announced the stoppage of any evictions and that statutory sick pay and universal credit is being offered for gig economy workers, people who are losing their jobs. It's also really good to see that utilities cannot be cut off during the duration of this crisis, and there seems to be quite a large bailout package for businesses to provide them with the capital that they need in this difficult time. But we think this needs to go further. Many health workers will be fighting to protect the health and well-being of millions in the coming months. To fight this pandemic, we need a radical reimagining of how we understand public health. We can only win this fight if we address the underlying social and economic issues trapping people, families, communities in cycles of poverty, poor health, and despair. Our public health is only as strong as our economic and social fabric. Existing measures such as self-isolation and social distancing will have a disproportionate impact on people in precarious work, living on low incomes with little savings or with insecure immigration status. That is really, really important for us to remember. The government has been responding, but we must see the following areas addressed. We need to ensure that there's secure housing. So for housing, we recommend a pause on all evictions, grant all renters affected by coronavirus, the coronavirus pandemic, a rent holiday, a pause on all rental collections during the course of the pandemic. There needs to be a plan for clearly protecting rough sleepers and those experiencing homelessness. We recommend using unused rooms in hotels and lodgings to house every rough sleeper for the duration of this crisis. There needs to be an amnesty on essential expenses. Incomes need to be protected for those facing joblessness and for families who are facing social isolation. Many people do not have enough savings to cover the additional costs related to disrupted working or to support themselves and their families. We therefore recommend amnesty on repayments of mortgages, credits, and other loans, and for unpayable debts to be written down. Amnesty must be extended to all utility bills. There should be no one experiencing power, water, internet cutoffs if they can't meet their bill payments. Furthermore, increase in statutory pay and an improvement in welfare. Statutory sick pay needs to be increased to a living wage and extended to all workers, both informal and informal work. A day one cash injection should be provided through universal credit infrastructure to all welfare recipients in order to secure their savings and their livelihoods for the next 60 days at least. All welfare caps, conditionalities, and penalties should be immediately stopped. But we also need to think about job security. Jobs need to be guaranteed where possible. For those experiencing joblessness, universal basic income support must be provided at the level of the living wage. Income support should be also provided to gig economy workers facing particular insecurity in this time. The government has announced an extension of statutory sick pay, but £94 a week is not enough to meet living costs, especially if people are living in London. Also, access to healthcare. We need to end all hostile environment measures, including NHS charging and data sharing. This is to ensure that all the migrants that are here in the UK receive care free at the point of access. We also need to conduct a public information campaign to ensure that people feel safe and are able to access care. Finally, we also need to show international solidarity in this situation. Trade sanctions prevent countries from responding effectively. These need to be ended. We need to work together with all of the countries of the world to ensure that medicine and equipment is supplied. We need to seize all arms sales. Conflict will only exacerbate the coronavirus pandemic. We're calling on all political parties to ensure that whatever policy is passed in the next few days and weeks supports those in the lowest income and in the most precarious positions. That's why we've organized this petition to be sent to all party leaders and all MPs. The asks are simple: secure housing, secure incomes, access to healthcare for all, and international solidarity. And we're up to 319 signatures so far. We need your help. Health workers need to join their voices and call for these demands. We need to make sure that party leaders and MPs know that the health voice here is strong and asking for a social justice approach to this crisis. I think it's important in this time to also understand how we can lend effort to this campaign. We're in a time where approaches need to be emergent and adaptive. Things are changing very rapidly, and we need to be mindful that whatever form of campaigning that we're in it for the long haul. So we need to work in sustainable ways. That's definitely been a learning for me. Being online all the time, working from home, there's been difficult to separate what time is on and what time is off. And as more movements go online, we need to learn from communities such as the disability community who've been organizing in that way for a very long time. Some of you who are on this chat might be already members of MedAct, or some of you who might not be. As MedAct, we have multiple groups across the country, and we can connect you with group coordinators, and also those of you who are new, we can provide you any assistant in getting up to speed with running a meeting online, and any other tech support that you might find useful. Rachel, our movement builder, is in the chat, and this is a really good person for you to reach out to if you're interested in doing this. We recognize that everybody is really busy at the moment, and that attention is being duly put to those most immediate to us and those who need our care. But there are a few simple ways that you can help us increase the reach of this petition. We want health workers to see this and to lend their voice around it. So anything you can do around Facebook posts, Twitter posts, on WhatsApp groups, or at least sharing it with 5 other health worker friends. That would be really, really good. And if you're interested in being involved in press opportunities, if you're interested in being a spokesperson, we're seeing a lot of health voices have traction in the media at the moment. And we will be able to support you if you're interested in being a spokesperson for our actions. So please don't hesitate to get in touch with us. We can also host blogs from health workers, and if there are also very specific aspects of the campaign that you would like to develop further, please get in touch with us. We have local groups and we send newsletters out to local groups, and we can provide you with text and you can adapt this. I think it's important for us at the moment to remember that we need to maintain solidarity and connection with our community around us. And in this difficult time, um, it's valuable to it's valuable for us to think about um, solidarity at large. We really need to come together in order to protect and provide social immunity to every person in the UK and show our solidarity to everybody else in the world. Thank you for tuning in. If you're interested in getting in touch, please message us. We're in the chat and you can get to us through our social media, or you can email us at office@medac.org. Um, Thank you for your time. I hope you go well, and I'm looking forward to talking to some of you afterwards and organizing with you afterwards. Thank you so much. Goodbye.